we good to go? All right, so we're going to talk about STIs in the older adult.
Again.
Next slide, please. So our objectives: STD, STI overview, STI statistics in the older adult, STI symptoms, treatments, and prognosis, and STI prevention. So for overview, due to stigmas associated with it, sexually transmitted diseases, now known as sexually transmitted infections, are often overlooked and not spoken about, especially in the older adult community. It has been proven that sexual activity is an important part of later life and has frequently been associated with increased heart health, increased self-esteem, and increased enjoyment in later life. While sexual activity typically decreases with age, specifically after age 65, many older adults still have a desire for sexual contact and engage in sexual activity. Because of the stigmas mentioned earlier, there is a reduced emphasis on safer sex behaviors in the aging adult, which lead to unhealthy sexual practices, in turn increasing STI rates among this age group. Our goal is to provide this education to you today so we can better prepare our older generation and bring attention to this important topic.
Me?
Yeah.
1 in 3 of women over 80 still have sex with their partners. Next slide. Types of STD and STIs. Next slide. Chlamydia, a bacterial infection. Chlamydia is transmitted during vaginal, anal, or oral sex through semen and vaginal fluids. It can infect the penis, vagina, cervix, anus, urethra, eyes, and throat. Often doesn't have symptoms. Estimated 1.8 million new cases in the US each year.
Gonorrhea, a bacterial infection. Gonorrhea is transmitted during vaginal, anal, or oral sex. It is spread when semen, pre-cum, or vaginal fluids get on or inside the genitals, anus, or mouth. Gonorrhea can be passed even if the penis does not go all the way in the vagina or anus. Often doesn't have any symptoms. Estimated 615,000 plus new cases each year in the United States. Next slide.
Hepatitis B, a viral infection affecting the liver. Hepatitis B is transmitted through the semen, vaginal fluid, blood, and urine during vaginal, anal, or oral sex. Hepatitis B can also be transmitted through needles, razors, toothbrushes with blood on them. It often doesn't have specific symptoms. Estimated 21,000 plus new cases in the US each year.
Hepatitis C, another viral infection affecting the liver. It's most often transmitted by sharing needles to inject drugs. It can also be transmitted during vaginal, anal, or oral sex. It often doesn't have any symptoms, with an estimated 57,500 new cases in the US each year.
Herpes, another virus affecting the mouth and or genitals. Herpes is transmitted skin-to-skin contact with the genitals and or mouth. Herpes is most easily transmitted when sores are open and wet, but can also be passed to others when they are no sores present. Most people get herpes from someone who doesn't have any sores. Can cause blistery sores. 1 in 6 people aged 14 to 49 has genital herpes.
HIV and AIDS is a virus that attacks the immune system, is transmitted through unprotected anal or vaginal sex with someone with HIV who's not aware of their status or not on consistent antiretroviral treatment. HIV transmission through oral sex is extremely rare. Sharing used needles, syringes, or other drug preparation equipment increases the risk of getting HIV. You may not show symptoms initially, and there's an estimated 1.2 million people living with HIV in the United States.
HPV, a virus with 150 different types. About 40 types of HPV infect the genital area, including the vulva, vagina, cervix, rectum, anus, penis, and scrotum, as well as the mouth and throat. HPV is transmitted from sexual skin-to-skin contact when the vulva, vagina, cervix, penis, or anus touches someone with HPV genitals or mouth and throat. Some types cause genital warts. Others include those associated with cervical cancers. They often don't have symptoms. It's most common STD in the United States.
Syphilis, a bacterial infection. It's transmitted from skin-to-skin contact through vaginal and anal sex. In rare cases, it can also be transmitted through oral sex. Symptoms can come and go and may include sores. Left untreated, it can cause permanent damage. There's an estimated 130,000 new cases in the US each year.
How many of these are there?
A lot.
I know. Trichomonas, a parasitic infection. Trichomonas is transmitted when semen, precum, or vaginal fluids get in or inside the penis. Trichomonas is often transmitted during vaginal sex, but it also could be passed through vulva to vulva contact, sharing sex toys, and touching. Trichomonas can easily affect the vulva, vagina, penis, and urethra. Usually no symptoms, but can cause vaginitis that may result in discharge and irritation. Estimated 2.6 million people living with trichomonas in the United States.
We're going to pass it to Jen.
STI statistics in the older adult. Sexual activity is an important part of later in life, frequently associated with better cardiovascular health, greater self-esteem, greater life enjoyment levels. We can have the next slide. STIs among older adults have dramatically increased in recent years, especially among those who are widowed or divorced. Those living in congregate settings report increased sexual activity, often accompanied with feelings of freedom and openness to sexual experimentation, which may increase their risk to contracting STIs. 23% of men and 13% of women drink alcohol prior to their sexual encounter. 15% of men and 9% of women reported having sex with transactional partners or new acquaintances. Less than 1/4 reported using condoms, even though more than 5% revealed their partners had an STI at their most recent sexual event. The most common STDs in the older population are chlamydia, gonorrhea, syphilis. Given this population is relatively safe from unintended pregnancies, the inaccurate appraisal of STI risk may stem from lack of sexual knowledge and underestimates of sexual risk for self and partners. Screening for STI knowledge is the first step to providing comprehensive education on safer sex practices, given the increasing incidence and prevalence among the older adults. Abuse in the older population is an intentional act or failure to act that causes or creates a risk of harm to an older adult 60 and older. The abuse occurs at the hands of a caregiver or a person they trust. Abuse, including neglect and exploitation, is experienced by 1 in 2 older adults who live at home. From 2002 to 2016, more than 643,000 older adults were treated in the emergency department for non-fatal assaults. Sexual abuse is something that is forced or unwanted. It could be a sexual interaction of any kind, or it could also be sexual harassment. Women are more at risk, 6 times more at risk than the male counterparts, and only 30% of them report the abuse to the authorities. 83% of victims reside in a nursing home. 27% of the sexual encounters can take place at their own home or in a perpetrator's home. 80% of the time, the perpetrator was the caregiver. 76% of the time, the incident was witnessed by another person. And 67% of the time, it's the family. There's signs that we have for the sexual abuse in elderly patients that we can recognize. If people are starting to withdraw or having sleeping disturbances, mood swings, there could be signs of something that's going on. And for anyone out there, if this has ever happened to you, there is somebody you can reach out to. Don't feel that you're alone. You can contact Adult Protective Service. It's a New York State service. The number's at the bottom of the screen. It's 1-844-697-3505. They're open Monday through Friday from 8:30 a.m. to 8 p.m. If it's, a family member and you're in a nursing home, you can use the chain of command in the nursing home, or vice versa. If it's someone in the nursing home, your caregiver, use this phone number. There is help for you guys out there. Always use it. Start there. Next slide. With the increasing rates of the STIs, according to the CDC, STIs have more than doubled in the past 10 years among US. So from 2007 to 2017, primary and secondary syphilis, the cases have gone from 91 to 349. Chlamydia has gone from 809 cases to 2,178. And rates for gonorrhea have increased from 707 cases to 2,063. Now, when we break it down to the state of New York, there's a whole snapshot right here. It breaks it down into all the three most popular. We have the syphilis, primary, early, gonorrhea, and chlamydia. If you look at the different regions, we have Albany County, Rensselaer County, Saratoga, Schenectady. Those are the ones, especially when it comes to syphilis, are more prevalent. Gonorrhea and chlamydia are, very prevalent around through all the counties. Next slide. Non-Hispanic Black individuals and men who sleep with other men have the largest rates of primary and secondary syphilis annually. The syphilis epidemic in the 1980s affected males and females equally. But now when you look at the statistics below, you can just see that primarily it's mostly among males. Next slide. Gonorrhea rates are among males, they exceed among females in all the groups. So with the gonorrhea and chlamydia, gonorrhea is more prevalent with males. Again, you can look at the numbers below than females. And then the next slide with chlamydia. Chlamydia is the most common reported STI in New York State. Chlamydia rates among females continue to be higher than males. Since all the trends, the upward trend of the STIs, it's starting to become more narrow between the female and male ratio though. Next. Again, I thought this was with our windshield project. So I put the Department of Health, Saratoga County, that you can always reach out and make appointments, free testing. Again, Albany County does have the same thing. I looked on their website a little while ago. Again, you can reach out, make appointments, get in contact with someone if you feel that you could have encountered an STI.
STD symptoms, treatments, and prognosis. Again, I must admit, I initially found this subject a bit of a joke initially when we came up with the idea, when we were going through the ideas as a group. This response I had, I really feel is part of the issue as a whole. I find the topic surprising, and it was way under discussed. With the rates of sexually transmitted disease in the older adults steadily rising, it's time for us to discuss this topic. Next slide. In my many years in the ER triaging symptoms in the older adult, our first thought is urinary tract infection, and STD swabs never come into the topic of conversations from my experiences. How many times does a family member escort their elderly mother or father to the ER or doctor's office? We need to create an environment where private, non-judgmental discussion can take place and not overlook the teaching moments. As healthcare members, we need to be aware of the embarrassing questions and remember the ability to cope with personal shame is a barrier for many older adults. Age doesn't protect everyone. It doesn't protect anyone from sexually transmitted diseases. It is essentially that the older adult and the healthcare team educate about the risks of STDs and remove the "it can never happen to me" and the embarrassment affiliated to the questioning. New trends in medicines have provided solutions to conditions like erectile dysfunction. These drugs have enabled more men to engage in sexual activity well into their older years. And this is probably where they got their nickname baby boomers. That was my joke again. Older adults may not have, this is kind of important. Older adults may not have received formal sexual education when they were younger, along with never speaking about safe sex at all. For instance, when I told my elderly mother of my topic, she had a lot of opinions on the subject. She spoke of premarital sex as taboo, and after getting married at 18, using condoms was strictly against the Catholic Church upbringing. Safe sex and STD prevention education became prevalent in the 1980s with HIV, AIDS. During that time period, many older adults were already married, middle-aged, and not have any chance to receive any formal education. Without this education, older adults may not realize the health benefits of engaging in safe, protected sex, even without the concerns of pregnancy. Next slide. STDs carry health risks without early signs. Another problem, healthcare providers tend not to ask their older patients about their sex lives. They don't always get screened for STDs. This creates a barrier with early recognition. Listening to the healthcare providers and healthcare workers, I agree the line of questioning needs to change when dealing with the older adult and these symptoms. Often physicians don't equate our older adults as being sexually active, and we may not be looking for the signs and symptoms of STDs because it's not the first thing on our minds, and I have to admit I'm guilty of that. Many people affected with STDs don't have immediate or obvious symptoms, or they have symptoms that can easily be mistaken for other health conditions. Unfortunately, that means the disease can go untreated, and it's this untreated time that causes and poses higher risks, such as cancers. That's why doctors recommend that if you are in a new relationship, we need to get tested for sexually transmitted infections and break down the barrier by which these questions are allowed to be asked. Let's take shame out of the picture. Next slide, please. The 6 most common signs of sexually transmitted infections are we have to physically ask questions. Don't just ask, how are you feeling? We need to ask, are there bumps, are there sores? Bring up the subject and physically ask. Ask if there are any unusual discharge. Ask if there is any itching or irritation. And ask if there are any signs and symptoms of any bleeding. Ask about the burning with urination and correlate it to habits of sexual activity. As much as you can describe the pain and irritation is another way that we can open conversation and allow these conversations to happen more often. And I know in my practice, it's going to be a question I'm going to add. Next slide. And the treatments, they have been treated for a very long time. Chlamydia, gonorrhea, hepatitis B, hepatitis C, herpes, AIDS, HPV. We're making strides monthly. with antibiotics, antivirals, and with early treatment, it's incredibly preventable, and it can make people just stay happy for longer. Next. Oh, that's me. Oh, that was my early detection. Early detection opens the doors for treatment, opening conversation, breaking down barriers. We were off a slide. And when left untreated, the results are deadly. But with conversation, we can live happy, healthy lives. Next.
So STI prevention. Next slide. STI infections have dramatically increased in recent years. Sexual activity levels typically decrease with age after 65. Large portions of older adults desire sexual contact and still engage in activity. Misconceptions have led to reduced safe sex behaviors, leading to unhealthy sexual practices. Increased STI infection rates among the older age group 65 plus is primarily caused by lack of knowledge. Next slide. According to the CDC, STIs have more than doubled in the past 10 years among adults 65 plus. Leading STIs are syphilis, chlamydia, and gonorrhea. Older adults report few opportunities to discuss their sexual health, limited access to educational resources and interventions, and primary focuses are on young adults for STI education. For prevention, the leading STI prevention is abstinence, most reliable way to avoid infection. Practicing safe sex using a condom for all sexual encounters, reducing the number of sexual partners, education on STI prevention with a primary health provider, communication with your sexual partner, mutual monogamy, sexually active with just one partner. Vaccines against some STIs are available. Most are cured with antibiotics again. So again, in prevention, we should break through the social stigma of speaking about sex and STIs. Cultural sensitivity is needed when speaking about these topics. Healthcare providers will not disclose information, no fear of being identified by friends or neighbors. Receive a STI test from your primary health provider, and people with lack of transportation can speak with providers remotely. These are our references. Do you guys have any questions? Again?